Hello, I'm so excited. Today we have one of the winners of Accessibility Innovation Challenge. And before I tell more about them and their project, I would like to introduce myself. This is again Puneet. I use pronouns he and him. I'm a person with dyslexia, dyspraxia, and stammering. And before we talk more about the project, I would like to request the team members to briefly introduce themselves and their pronouns as well. I would like to hand it on to Prashant.
Yeah, hello everyone. My name is Prashant Ranjan Verma. I use the pronouns he/him. I am based in India, New Delhi, and I am visually impaired. And as far as visual description is concerned, I think I have black hair, brown skin, and I wear high-powered glasses. Yeah, I think my team members can also introduce. I think Nikhil, followed by Cheryl.
Yeah, hi, I'm Nikhil. I am from Bangalore, India, and my pronouns are he, him, and I'm currently wearing a maroon shirt and I have black hair.
Yeah, hi everyone. I am Cheryl Ratsonkar. My pronouns are she/her. I am basically neurodiverse. I belong to neurodiverse disability, and right now I'm wearing blue top and tied my hair up in a bun.
Thank you, Cheryl. Thank you so much. Talking about my teammate today, one of my teammates is also joining. He is the co-founder of GNYPWD, and he is a wonderful colleague of mine. I would like to request Kartik for his brief info. Yeah.
Thanks, Puneet. It's such a pleasure to join you today on this podcast. So my name is Kartik, as Puneet introduced. I am blind. My pronouns are he, him, and it's just very good. I am an Asian, a South Asian male in my late 20s, and very excited to be with all of you today.
Thank you so much, Karthik. It is going to be really exciting as we have a lot of technical, lot of engineers, and I'm feeling little left out. But let's begin the conversation. And to start up with, I will give a brief info about one of our winner team that is accessible. So as they said that they are based in India, and the project is titled Information Access on SRH Topics. HRH, that is Sexual and Reproductive Health topics, using conversational flows in low resource settings. People with disabilities often have limited access to sexual and reproductive health information and services, particularly in areas with limited internet access. Accessible provide interactive engagement via SMS and interactive voice response, which does not require a computer or smartphone or any technical training. They are available in local languages as well, and the platform ensures that critical information and services are readily available to people with disabilities regardless of their location or the device they use. So, my question to you, Prashant, can you explain briefly your project and your idea to a person who has just joined in and who doesn't know anything about accessible?
Yeah, okay, yeah. So Accessible is a company based in India, and we provide accessibility and inclusion services. So we have worked with many companies all over the world, and we have also worked with many UN agencies. We have helped in conversion of their publications to accessible formats like EPUB and PDF remediation, and we have also done like lot of work related to making the web accessible, accessibility of the web, mobile apps, and training in accessibility and disability inclusion for like the staff of various companies. So we are very excited that we got selected for the Accessibility Innovation Challenge, where GNY GNYPWD is also a partner. And uh, so as you have already given a good brief of the project, so we have been feeling the need for such an intervention in and around us. I have been working with the person with disabilities for many years, and we see that yeah, there is very like lot of diversity within the disability community, and many of them don't have access to internet, or sometimes they lack technical skills. uh, and then very often there is a language related difficulty as well. So much of the information is available in English, in an easy to access format. So there we have felt the need for this, that there should be a mechanism where people with disabilities in rural areas, in semi-urban areas, uh, they should be able to access information related to sexual and reproductive health, using maybe just a simple phone, uh, so that like lack of internet or technical skills doesn't come in the way. So we are hoping to build up this service where people will be able to maybe just call a phone number, and ask questions in local language, uh, and they will be able to get very reliable and accurate information from the other side, from our system, from the artificial intelligence that we are building. And we are trying that the responses are in natural language and they are easy to understand. So this is mostly about the project.
Thank you, Prashant, for that. That is really clear. But that makes me ask you that, as you said, that disability community is itself very diverse. So, can you share with us like how accessible ensures that it is like the services are not just available but also inclusive and accessible for people with various types of disability? Anyone can take this question. Like, yeah.
Yes, yes. No, good that you asked this. Actually, I should have added this information. So, so we are aware that that not every person will be able to speak and ask questions. They need some other ways also. So the system will also be available using SMS, like short messaging service. So people will be able to put their questions in text, and they will be able to get the same information. So there are like multiple interfaces, SMS and the voice response system as well. And other aspect of what we are trying to build is to convert like complex web forms into simple conversation flows. So using SMS or IVR method, people will be able to, say for example, register for a maybe a health service, for example. um, the system will ask questions, take the responses, and then fill up the form on their behalf. So so we think like we will be able to cater to a wide category of people with disabilities, because it's not dependent on voice alone. There are alternative methods.
Hmm. Yeah,
Yeah.
definitely so. And Prashant, what makes me really excited about this project is that it is available in local languages as well. So language barrier is tried to be like not there. So we talk about local language and the culture and that is in the remote areas of the country. So your like your services is available in local languages as well. So, how it is being ensured that the content is not only linguistically accessible but also very culturally sensitive and appropriate as well?
Yeah, I'll be happy to take this one. Uh,
Yes.
yeah, so exactly that is a key aspect. So as we mentioned before, it's not just enough to just me able to make our services in Hindi or other regional languages. It is equally and if not more important to ensure that the data itself is relatable. So this involves using the culturally relevant terminology. ensuring that we are able to account for feedback coming from people with disability on the ground, and also something which is particularly challenging in a country like India, with various dialects, states, experiences, etc. And something that is challenging is to account for this diversity. So we are working with local partners who have more experience on the ground to get this data and information so that we can leverage them in our model. So, for instance, we are currently in conversation with Project Bala that has developed curriculum and resources for young women with disability in various regions of India. So, and this curriculum uses language that they understand and account, and it takes into account sensitivities as well as cultural realities on the ground. So, and we also hope to work closely with UNFPA country office in India that has already been doing this work with the mainstream youth constituency to get experiences from them, and we also believe that a lot of terminology can translate very well to the disability community as well. So that's how we are thinking about it.
Thank you, Nikhil, for that. And as we know, technology is a great enabler, is a tool. But what challenges do you faced when you were like try to like execute like infrastructure in terms of like SMSs and the interactive voice response, particularly considering the diverse needs.
Yeah. So the key challenge is to ensure that the data is relatable, and it accounts for the contextual reality on the ground. So, for instance, a lot of official and technical terms can be used in sexual and reproductive rights and health information that is available on the internet. So, but those aren't necessarily the words used by the general public. So, how do we ensure that the AI is able to use the vernacular? That is the key challenge. Since AI relies on data to be trained, it is important that the data is something that is actionable and something that the people actually use, not just something that is available in official document. So, additionally, another challenge is the robustness of the system itself. So, we have to account for different disabilities impacting how people phrase their questions or speak. So, for instance, we have to think about people who have atypical speech and might want to use IVR. So, it is with this in mind that we currently are providing both SMS and IVR, so that everyone has an option to use what they prefer, either text or voice. But eventually, we want to be able to account for these circumstances as well. So this is particularly hard in AI, since again AI relies on data, and there isn't a lot of data involving atypical speech or language that may not necessarily conform to the regular language that you and I speak. So these are some of the challenges that we have faced till now.
Yeah, yeah. So, Nikhil, as you said that you are partnering with Project Bala, and this accessibility innovation challenge is also being partnered like with UNFPA is there, GDI Hub is there, and of course GNYPWD is also there. So partnership is very important, and it is very critical part of how we want to scale, and how we want to be like really impactful in our work. But what are the challenges that comes when you communicate your desire and your wish to like collaborate and come and partner with some other organizations?
Uh, okay, so I can take this. So actually, uh, the fact that this project is being supported by UNFPA, a reputed international agency, and GDI Hub and your network is also involved. So I think that helps actually. Uh, uh, so we have actually some association with Indian organizations already, organizations working for persons with disabilities, and through that we are in a position to kind of test the system, get good feedback. But then the fact that this project involves such agencies, that is helping us, I think, in forming some association with with other agencies which are particularly working in this field. So that is how that collaboration with Project Bala is progressing. And and uh, UNFPA India team has already kind of approached us, and we are hoping to set up some meetings with them. And they seem to have accumulated a lot of useful information, particularly about the services or infrastructure in this health field. So we will see if we can get access to that through them. Yeah,
Thank you.
yeah.
Yeah. So also like sometimes as innovators we or as founders we get so focused, so obsessed about our our solution that that we do not listen to the audience. We do not listen to our beneficiaries to which like we are working for. So can you share some stories, some really like positive feedback which really like gives you the hope for better future?
Yeah, so well, currently we do not have our first MVP ready to test with people with disabilities yet. But as we, already mentioned that we have been co-designing our entire project with them throughout. So whatever interactions that we have had or whatever feedback that we have had, it's very, very positive till now. And literally, young women with disabilities, have opened up about many sensitive challenges that they have faced, right? So while talking to them, the big challenge that we faced was, like we already said, that there's a really lack of relevant information and resource in language in their own uh, regional dialect and accent and terminologies that they use, and the way that they consume content, right? So let me tell you one very one incident that happened very recently. So I was interacting with these young girls, very young girls, like teenage girls from Dharavi, right? So we were telling them what all our project is and how we are trying to, educate them and tell them that there is some AI where they can ask anything and everything. So this very young girl stood up and said, she said, and I quote that, Didi, this sounds really, really great, because when I had my first period, I used to have so many intimidated dreams that, and actually she was orphan. She doesn't have her parents, and she had her two siblings which were younger to her. So she was like, "Ki, I'm so glad that now at least my sister uh, could get something from this tech era and this sort of a project, that she won't be this intimidated by, if anything, something like first time she got her period, and she won't be that intimidated, right? So these are like small impacts which is very I mean close to my heart. Like our project is capable enough, to help these kind of people who lives in slums or semi-rural areas, or semi-urban areas and rural areas, right? So this was kind of that's how we thought, we think that our product will definitely have substantial impact on our community, right?
Thank you, Sharil. Yeah, of course, I totally agree with that. These are the small incidents and small stories that keeps us going, and also like
Exactly.
yeah. So uh, like I don't know if I'm not informed or just to ask that when I started to like read about your project, and it says that without internet and without smartphone, this project can be implemented. So I was thinking that maybe 10 years back it was very relevant that even in remote areas we don't have internet and smartphones. But when I go and visit the villages, now like everyone has smartphone, everyone has internet. So I was thinking that is there any place in India where there is no internet? So I was just curious about that. like any data or any stat that talks about how much percentage of India have internet access or have it?
Puneet, your voice is breaking a lot. I think
Yeah, Puneet,
he
Puneet, your
might not
voice.
be able to
Yeah,
hear.
so your voice is breaking a lot. I'm gonna maybe try and ask this question, but also answer to some extent and qualify what Puneet said. Puneet's question was around the relevance of something like this. When you think about SMS and IVR and uh, people not having to the internet, people not having internet. Uh, Something that you're observing, of course, is that the coverage is increasing day by day, right? Now, I'd qualify that by saying that we still know that around 60% of people with disabilities still don't have access to the internet per GSMA, which is a very alarming statistic when you think about it. But I'm going to maybe ask Puneet's question in a different way, which is, you know, currently I think it's evident that there's a need for this. We need to reach those 60% that we typically haven't been able to when you think about a lot of the assistive technology. But how would this change, right? Because I can totally imagine 10 years later or 5 years later when we will be able to provide access to these people as well through the internet itself, right? I mean, there are projects like Airband and others around the world that are exclusively focused on this. Even big tech giants, like Google, etc., are all talking about it. Meta is talking about it, right? In terms of connectivity. So my question is, how do you think about the relevance of this project when that happens? I mean, do you see that? Uh, is SMS and IVR really the key part, or are you thinking about the information and how you're delivering as sort of something that would still be relevant, and the project would still make sense even after there's a lot of connectivity?
Yes. No, I think this will be relevant even afterwards. So, so what we are trying to do here is that kind of build up a system which has a lot of information and very credible information, and that system is able to retrieve information according to the user's query. Now, the alternatives to this, even if people have access to internet, then they actually have to kind of look for the source of information themselves, and then kind of themselves decide what is the correct information, what is reliable, not reliable. So it's not easy. It's sometimes also, you can say, misleading, and sometimes also risky as well. So uh, uh, and then, like, even currently people can say that, okay, same information could be provided by a family member or a friend, but then they also there are several issues, like there are privacy issues. The person with disabilities may not open up and ask all these questions frankly. Secondly, the other person also may not be all that well informed, and may not be able to give the best advice. So, and then even if access to internet is there, and even if the device is there, the capability to use the internet and the device requires like some degree of, you can say, literacy, and uh, technical training or ability on the part of person with disability, and accessibility as well. So the digital systems, websites and apps and all, unfortunately, at this time they are like, majority of them not inaccessible. And I don't know, they will probably improve, but we don't see a situation where um, the systems will be absolutely accessible to each and every person with disabilities. So our system will be, I think, a very good alternative, and probably it will be probably preferred by, I think, many persons with disabilities even in the years to come.
Well, I'm going to ask a quick follow on to that for anyone who wants to take that. And I think you mentioned an important aspect around this, of course, being focused on SRH right now, but potentially having more avenues in which this could be helpful. And so, as you think about scalability of the project, and how do you scale your impact? How do you see your future plans? What is it that you're trying to do, and what's the plan there?
So I can take this one. So the SMS and IVR modes of interaction themselves have been designed with a view to help us scale and reach those that are otherwise left behind due to technology. So not being as so the technology not being as prevalent in some of these regions and also among some of these demographics. So our goal right now is to make it very robust so that we not only provide them this information but also expand it to include a lot of other services that are otherwise commonly available over the web. So, in fact, one of the components of our project is task automation. So that what it does is this how do we help automate common tasks that we complete on the web, such as form completion, like completing submitting forms and filling information, and can we convert these into conversational experiences and perform the action on behalf of the user over an SMS or IVR call so that they can participate in the digital economy and so that they can take advantages of the digital resources and services even if they don't have internet access. So as you can imagine, the application of something like this is not just limited to SRH but can be expanded to a lot of other scenarios including provision of other benefits. Yeah.
Sounds good. Puneet, are you around? Can you hear us?
Yes, yeah, yes.
Awesome.
Can you?
All right.
Yeah. So only the last question, because we are at the end of this episode, and so I would like to ask, like, how can people support you or get involved with Accessible?
Yes, okay. So I think we need people support soon in testing. So we will I think approach a community of person with disabilities. They can also contact us. So we will need them to test and give us a review feedback for improvements. And when we are able to actually formally start or launch the service, then we need
Yeah,
people
thank you,
support.
Prashant, for that.
Yeah,
And
to actually spread the information around. Yes, Puneet.
Okay, looks like Puneet is having some issues with internet today.
Yeah.
No, well, again, we're at the 30 minutes. So again, would really want to thank you for your time and for all the amazing work that you're doing as part of the Innovation Challenge. And we look forward to staying in touch, collaborating, and helping more and more people access this so that people can get access to information. I think one of the things that we believe very strongly at the network is access to information is key, because that can really have a defining and pivotal sort of impact on what you can and cannot do, like really providing you that agency to be able to think about what's right for you and what's not. And so for you to be able to do that for people who otherwise actually are left behind, even with the assistive technologies that we have access to, is actually pretty commendable and much needed. So again, congratulations on the project. Super excited to have you as one of the winners of the Innovation Challenge, and we are looking forward to kind of testing out the application when it's available, but also providing it to our community and our network, and getting you feedback from them as well. So again, thank you so much for your time. For all of the listeners, again, if you want to be associated with a community of young people with disabilities, head to gnypwd.org. That's gnypwd.org, and we'd love to welcome you to our community as well, so that you can interact with and provide your feedback to solutions like AccessAble, to ensure that we can all work together to have a lot of impact in our community. Thank you so much again. Really appreciate your time.
Yeah. Thank you very
bye
much.
bye. Take care.
Thank you.
Thank you.
Bye. Bye.
Thank you.
Bye.
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 Bye.